across the whole country, healthcare leaders are coming to us and telling us how extremely worried they are. They're telling us that they're more worried than they have been on any of the previous strikes, just because of the scale of the strike and the amount of days, not just the 4 days of the actual strike, but of course having timed it to happen right after the Easter break and sandwiching it between 2 weekends. We really will expect there to be disruption for 10, 11 days. It's a massive concern.
Do you think patients will die as a direct consequence of these junior doctor strikes?
Well, it's certainly the case that healthcare leaders are working as hard as they can and putting in every mitigation that they can to try to keep things safe. But the reality of the situation is that there is a need for a certain amount of cover in healthcare settings, and they're really anxious that they might not be able to achieve that level of cover. That's because, for example, some consultants and specialist doctors who would otherwise have been able to cover have got pre-booked leave that they might not be able to cancel. It's also because there might be increased demand in certain hospitals, particularly in those holiday hotspots, as there always are over Easter. And that's why we're hearing of hospitals across the country having to postpone elective surgery and appointments in really large numbers during this industrial action. And of course, many people will have already heard about that for their own appointments, which is of course incredibly frustrating for everyone. But the reason for that is to make sure that they can maintain enough capacity as much as possible for those most urgent and life-saving needs.
We know in previous NHS strikes there have been provisions by the unions to make sure that emergency care is protected and that people would, come off picket lines and things. The BMA isn't saying people won't come off picket lines, but that emergency provision hasn't been kind of factored in such a formal way as other unions. Do you think that's irresponsible?
Well, it certainly makes things more challenging because, of course, that means that all capacity really needs to be funneled towards making sure that people can be looked after in emergency and urgent situations. So it makes things very, very difficult across the system. But obviously, healthcare leaders know that this is the issue and they have been working very hard to try to figure out how to manage the situation.
I wonder if you think the government should be doing more. We saw, I think it was yesterday evening, wasn't it, a statement put out by the BMA saying, look, if the government is prepared to sit down with us and put a proper offer on the table, we will suspend these strikes right now. But they feel that the government is blaming them and is not prepared to actually sit and listen. Do you think that the government to some extent is at fault here?
Well, I mean, I think it's really incumbent on both sides, isn't it? Because what we have is the people negotiating for the junior doctors on one side, with a starting offer that the government is saying it considers very high. What we have on the other side is the government who doesn't seem to be able to come to a number to bring them to the table. So what really the NHS Confederation would ask is that both sides really just figure out how to sit down and start having genuine, meaningful conversations, because as long as the stalemate continues, it's not good for anyone. It's not good for patients. It's not good for NHS staff. It's obviously not good for the government. It's not good for anyone. It's a real risk, and we need to move past the stalemate and move towards a solution, and as soon as possible.
What would you say to people listening to this who are anxious? You've outlined very starkly the challenges that the health service, well, we know faces on a day-to-day basis anyway, but over this 4-day Easter weekend, then the strikes next week. What would you say to reassure people? Can you say anything to reassure people who may be feeling anxious?
Well, the national advice continues to be that if you need healthcare, you should continue to seek that healthcare. You may be reassured to know that the impact on primary care, so for example, attending your GP, attending pharmacies, is very much less impacted by this. But it is certainly the case that you might expect some of your pre-booked appointments to be postponed. You might expect there to be longer waits, but be assured that healthcare leaders across the country are going to be doing absolutely everything they can to maintain patient safety during this time.